Hello, everyone. Jamie is back with yet another interesting webinar, and this time it's about leading a healthy life. But before that, let me introduce myself to you all. I'm Samutrika Patnaik, and I'm the client partner at Global Market Estimates. I would like to welcome you all with a hope and belief that each one of you will benefit from our today's session. I also want to ask you all, are you passionate about promoting health equity and ensuring that everyone has an equal opportunity to lead a healthy life? Well, if the answer is yes, then attending today's webinar is the first step towards that goal. We firmly believe that the key to achieving optimal health outcome lies in understanding and addressing the social determinants of health. Far beyond medical care, these determinants play a pivotal role in shaping the health and well-being of individuals and communities, regardless of their age, gender, race, or socioeconomic status. So we will be discussing about the social determinants of health market in a few moments. But before that, let me inform you all that a recorded version of this webinar will be shared via email so that you may also always, look back to the actionable insights and valuable findings of our key speaker. And of course, your suggestions and inputs are much welcome and appreciated. So now let's begin this webinar with a quick introduction of our company. Global Market Estimate is a market research and a business consulting company having a proven track record of helping 80% of Fortune 2000 companies since years now. We have always believed in providing our clients with high quality and premium advisory services. And with a vision to transform the market research industry, we are driving global market estimates towards a perfect integration of technology, innovation, and excellence. Moreover, we are on the verge of introducing disruptive technology platforms in the market research space. Now, if you allow me a couple of minutes to discuss the flow of the webinar, and in the meantime, you all can check the chat box where we'll be sharing our contact details and the report links as well, so that you can let us know what all reports you're interested in, and our team will get in touch with you. So as you can see in the slide, we'll be starting this webinar with the benefits and bonuses of attending today's webinar, followed by a brief about our company, which is Global Market Estimates. So what we do, how do we do, whom do we serve, followed by what makes us unique and GME's capability in the social determinants of health by our key speaker, Ms. Haritama Kashyap. Then we'll take the Q&A session. Along with this, there will be an announcement of some complimentary reports and additional bonus worth 1,500 US dollar for all the participants who choose to stay connected till the end of the webinar. This is a small goodwill gesture for all your precious time. And thereafter, we'll conclude the webinar. So let's begin with the benefits and bonuses of attending today's webinar. Let me start by saying how much I appreciate you all for taking the time to attend this webinar. As a result of your interest in this webinar and my assumption that you want to learn more about it, we will send every participant a free executive summary of our report on the global social determinants of health within the next 48 hours. This summary will provide a short overview of the important insights, trends, and forecast about social determinants of health market. I would request you all to keep an eye in our chat box for our contact details and the report links. You can also write us back on sales@globalmarketestimates.com. I would like to repeat the email ID once again. That is sales@globalmarketestimates.com. And you can request for a sample report there as well. Furthermore, we provide Q&A sessions with our key speaker as part of our commitment to facilitating knowledge sharing. Here, you will get a chance to communicate directly with our industry expert during this interactive event to learn insightful information and get any questions about the social determinants of health market answered. And of course, all the attendees will have the opportunity to determine tomorrow's high growth markets today. This implies that the webinar will cover emerging niche markets within the social determinants of health that have significant growth potential. And by identifying these markets in advance, attendees can also position themselves strategically to capitalize on future opportunities. Not only that, the webinar will also provide insights into the social determinants of health sector, and our key speaker will share her expertise and knowledge about emerging technologies within the SDOH market. And I'm sure this information will, help you in a very appropriate manner. And I'm sure this is a bonus that you would not want to miss on. So let's move ahead to the next slide now. So here we'll be talking more about, GME, which is our company global market estimates. So often our clients ask us, what we do, whom do we serve? So today, let me answer all of that. So we are a revenue impact company and we demonstrate the latent demand for you and for your clients that can lead to better planning of go to market and can justify ROI with target clients. We tell clients what their current revenue mix should be and what their future revenue mix should be in the coming 3 to 5 years. We also help accelerate focus and decisions by 6 to 12 months. And the impact of what we do is a minimum of $100 million for every $1 billion of current revenues. Now, you may ask, what do we do? So, we solve connected problems. We use a decision making platform and a pool of 100 plus researchers and analysts to connect some very complex dots. We have researched 25,000 high growth niche markets in the last 6 years and have the world's most detailed view of connected and converged ecosystems. We use this to study the impact of disruptions and technology mega trends on industry business models, our clients' business, their clients' business, and their clients' business. Now, how do we do? So, enterprises, more often than not, work in silos. We implement our advice by working with several departments on how revenue impact and future revenue mix should be managed. This could be helping marketing team segment target and position, could be helping sales team with account planning and messaging. It could also be helping product management understand future focus areas. Could be supporting CMI and M&A teams identify partners and M&A targets. So our annuity model is a powerful way to engage with us. Now, whom do we really serve? So I feel so proud to say this that with every quarter, we're becoming more widely used by our clients. Over 30,000 company officers approach us annually to solve simple and complex problems. And we believe that every single company in the world should work with us. And our target is to be $1 billion company in the next 3 years. That is the reason why we have been lately approached by various venture capitalists from across the globe. So let's move ahead and see, global market estimates in a detailed manner. So, we have been in this consulting business for more than 6 years now, and we are becoming more and more confident as CXOs of top Fortune 2000 companies are using our reports to upscale their business to understand the growth strategy of the industry. And our robust research methodology is something we and our clients can vouch for. Not only that, we also provide our clients with strategic opportunity and attractiveness analysis, which includes, hot revenue pockets, market attractiveness score, business strategic priority, technological adoption rate, high growth states or cities, which would, help you to focus on the specific states or areas. And our reports will also cover the 4 quadrant competitive positioning matrix, which is a very important benchmark to understand, your company's position in the market, and of course, to understand your competitor's position as well. Along with that, we'll be providing you a detailed competitor analysis as well as consumer analysis and strategic insights across business functions for CEOs, for CMOs, and for chief strategy officers as well. And last but not the least, with the help of our actionable insights, you can also evaluate the potential of your existing business line versus the new lines to enter into. And as you can see in the slide, we are the faster, as compared to our competitors when it comes to niche high growth markets. And we provide greater granularity in market segmentation for each of our reports. And quick turnaround time with efficient result is our topmost priority. So lastly, our research is done with a single objective to help organizations grow their revenues throughout, effective decision making. We'll be definitely happy to share our company profile in the chat box for you to better understand our growth story. Now it's time to invite our, key speaker. So I would request Ms. Haritama Kashyap, who is the lead analyst for the Social Determinants of Health industry, to kindly share her actionable insights covered in the report. Over to you, Haritama.
Thank you, Samudrika, and greetings everyone. It is my pleasure to introduce myself as Haritma Kashyap, your lead analyst for today's webinar, where we'll be diving into the captivating topic, namely global social determinants of the health market. Today, we gather to explore the vast potentials of this market and its transformative power in changing patient care and the healthcare industry as a whole. In this engaging session, we'll be discussing the dynamic landscape of social determinants of health and how these factors exhibit the potential to improve the population health and reduce overall health disparities. Starting with the market size analysis, the report provides an in-depth analysis of the current market as well as projected growth trajectory for the market, along with compounded annual growth rate for the forecast period. Our report also provides a comprehensive analysis of various segments and subsegments of the market at global, regional, and country level markets. This information will help assess the market's attractiveness and potential for investment or expansion plans in the future. We have also identified key competitors and provide valuable insights into their market positioning. Additionally, the report highlights the latest trends, challenges, market drivers, and key opportunities that can serve as the source of lucrative revenue growth during the forecast period. Thank you all for considering our report, and we hope it provides you with valuable insights and guidance. Moving ahead, so social determinants of health basically refers to the non-medical factors that influence a person's overall health and well-being. These factors are rooted in the social and economic condition in which people or individuals live, work, and play. Factors such as socio-economic status, education, employment, physical environments, and access to healthcare and social and community context all play a role in determining health disparities and outcomes. And so, recognizing the importance of social determinants of health, many healthcare organizations, policymakers, and public health agencies have been focusing on addressing these factors to improve population health and reduce overall health disparities. For example, healthcare providers may develop interventions and programs that target at risk population and work with community organizations to address the underlying social factors contributing to health issues. In today's world, this concept has become an essential consideration when it comes to healthcare industry's effort to transition from a traditional fee-for-service model to value-based care and population health management. On the other hand, healthcare technology companies may offer solutions that help identify and address social determinants in patient populations, but it's more of an integrated approach rather than a separate market. As a health system increasingly prioritizing the preventive care and holistic approaches to patient health, the importance of understanding and addressing social determinants of health continues to grow. Now, talking about the market size, as per our analysis, the global social determinants of health market is expected to grow from 28.4 million US dollar in 2022 to 95.9 million US dollar in 2028, growing at a compounded annual growth rate of 22.5% from 2023 to 2028. And this growth is supported by several factors. For instance, there has been a growing understanding among healthcare stakeholders, including policymakers, healthcare providers, and payers, about the significant influence of social determinants on health outcomes. This awareness has driven the need for innovative solutions to address these determinants effectively. Another factor which is driving the market is increasing healthcare costs, which has led to shift towards value-based care, where providers are incentivized to focus on preventive measures and outcomes rather than treatment model. Moreover, addressing social determinants of health can lead to better health outcomes and reduced health care costs, making it an attractive proposition for health stakeholders operating in the healthcare industry. Furthermore, the advancement in technology, particularly in data analytics and artificial intelligence, have facilitated the identification and tracking of social determinants that impact health. These tools enable healthcare organizations to develop targeted interventions and monitor the effectiveness of their social determinants of health initiatives, thereby driving the market revenue. Also, the healthcare organizations are investing a lot of time, money, and human resources into addressing health equity and social determinants of health. It has been found that private insurance companies have spent more than 1.87 billion US dollars on social determinants of health data over the past years, with top six insurance company being responsible for over 70% of this expenditure. Also, a study indicated that over a 2-year period, 57 health systems invested at least 2.5 billion US dollar on addressing and understanding social determinants of health. This concept of healthcare is receiving a significant attention and funding, and thus expected to grow exponentially in the coming years. On the other hand, just like any other market, this market is also surrounded by certain challenges that are expected to hamper the market growth up to considerable extent. For instance, gathering comprehensive and accurate data on social determinants can be challenging due to the fragmented nature of data sources. Also, these data often include sensitive information about individuals' living conditions, socioeconomic status, and other personal details. So, ensuring privacy and data security while sharing and using the data for healthcare purpose is critical challenge that must be addressed to gain trust and compliance from patients and the community. Now, as I mentioned earlier that we provide analysis at segment and sub-segment level, here you can see that we have segmented the market based on factor, data type, application, and end user scope. Talking about the factor scope, we have segmented the market into economic stability, environment, social context, and education, among others. Among these, economic stability is playing a vital role in shaping the market growth. This is primarily because economic disparities and income inequality are becoming more pronounced, leading to an increased focus on addressing social factors that impact the health outcomes. As a result, government bodies, healthcare organizations, and private stakeholders are investing in initiatives that target poverty alleviation, employment opportunities, and financial assistance programs, all aimed at improving overall population health. Now, the second chart demonstrates the data type penetration in the market as shown here in the chart. Currently, publicly available data is dominating the market with highest revenue share. This is because publicly available data plays a crucial role in understanding and addressing the social determinants of health on a broader scale. This data encompasses information from government agencies, non-profit organizations, and research institutions, providing valuable insights into various social factors such as education, income, housing conditions, and environmental factors. Also, with advancements in data analytics and artificial intelligence tools, healthcare providers and policymakers can harness this wealth of information to identify vulnerable population, predict health disparities, and develop targeted interventions to address systematic inequalities. Furthermore, talking about the application scope, there's a rising demand for robust authentication systems that can securely verify patients' identities to ensure accurate data collection and analysis. These authentication solutions are crucial in maintaining patients' privacy and enabling seamless access to personalized healthcare services. Now, talking about the end users, payers such as insurance companies and government agencies are increasingly recognizing the impact of social determinants on health outcomes and healthcare cost. They're actively investing in social determinants of health initiatives and programs to address socioeconomic disparities and improve the overall health of their insured populations. By incorporating social determinants of health data into risk assessment and care management, payers aim to enhance their population health management strategies and achieve better patient outcomes. On the other hand, providers, which include healthcare systems, hospitals, and clinics, are also adopting social determinants of health approaches to deliver more comprehensive and patient-centered care. Now, moving on to next slide, let's talk about the key stakeholders in the market. So, the social determinants of market involves a diverse range of stakeholders who plays a critical role in addressing the and improving social determinants that impact the health outcomes. These stakeholders often enter into partnership to develop and implement interventions aimed at addressing social determinants of health. In the left chart, you can see that I have mentioned few key stakeholders. Just to mention, there are just few examples. There are many other that are operating in the market. So one of the main key stakeholders in the market are technology companies, which play a significant role in identifying and addressing social determinants of health. This include companies that develop data analytics platforms, electronic health records, and other health IT solutions to facilitate the integration of social determinants of health data into patient care and population health management. Now, second is healthcare providers, which include hospitals, clinics, primary care physicians, and other healthcare organizations. They play a vital role in identifying and addressing social determinants that affect their patients' health and well-being. They may integrate the social determinants of health interventions into their care plan to improve health outcomes and patient satisfaction. Now, followed by social service agencies that focuses on housing assistance, employment support, food programs, and mental health services. Then we have health insurance companies and payers who have a devolved interest in addressing social determinants of health and as it can impact healthcare cost and the patient outcomes. Last but not least, we have community-based organizations that are essential key stakeholders in the market as they often have close connections to the communities they serve and are well positioned to address specific social determinants such as housing, food security, education, and employment, and many others. Now, considering unique role of each stakeholders in driving innovation and competitiveness in the market, we have studied each market player as a part of our research methodology and to better understand the market growth in the coming years. As you can see on the right side, we have listed down some of the key stakeholders that are studied in terms of their role to better assess the market. This includes evaluation of their offerings and various organic and inorganic growth strategies undertaken by them to advance this market. Now, talking about these strategies, investment in R&D, product development, and operational efficiency improvements are some of the organic growth strategies that are being undertaken by the companies, whereas inorganic growth strategies include merger and acquisitions, strategic partnerships and alliances, and many others. So as you can see here on the left side, strategic partnership is one of the most widely adopted growth strategies by market players in the space. Many organizations have formed partnerships and collaborations to leverage combined expertise, resources, and networks to address social determinants of health comprehensively. For example, healthcare providers may partner with community-based organizations, social service agency, or technology companies to develop innovative solutions. One such collaboration is a partnership between cashless payment and Unitas, a technology which is a technology company that connects individuals to social services to address social determinants of health needs in California. Similarly, to mitigate the challenge of identifying people experiencing homelessness, a Western state in the US Medicaid program partnered with LexisNexis Risk Solution, a technology company, to access extensive social determinants of health data. These growth strategies are not mutually exclusive, and companies often employ a combination of organic and inorganic growth strategies to approaches to achieve their growth objectives based on the market dynamics, available resources, and strategic priorities. Now, moving ahead, as I mentioned earlier, that we do provide data based on the global, regional, and country level market. So we provide a detailed analysis into the regional as well as country level market. For instance, here you can see that North America market is currently dominating the market with highest revenue share of 38.5% in 2022 market. And the regional market is primarily driven by the US market, which accounted for 67.5% revenue share in the North America market. And the growth of US market is primarily contributed by the increasing number of substantial players in the country, as well as increasing adoption of social determinants of health data within healthcare settings. Now, talking about Asia Pacific market, Asia Pacific market is expected to grow at the fastest compounded annual growth rate of 24.2% during the forecast period, with China, Japan, India at the forefront. However, India market is expected to grow the fastest at a compounded annual growth rate of 23.8%. The key factor contributing to the growth of this market is expanding healthcare industry in the region, as well as growing popularity of social determinants of health data in improving health outcome. Also, increasing concerns of healthcare service quality gaps between the patients and providers is anticipated to create enormous opportunities in the Asia Pacific region. So we can say that while the North America being the market leader, Asia Pacific market is certainly the fastest growing market and can be recognized as a lucrative source of revenue growth in the foreseeable future. So to conclude this, I would say it is important to note that this market is continuously evolving and the new trends would continue to emerge. This shift towards prioritizing social determinants in healthcare is likely to continue as the industry recognizes the potential to create a healthier and more equitable society by addressing the root cause of health disparities. Furthermore, policymakers, healthcare providers, and technology innovators are expected to play very crucial role in shaping the future of the social determinants of health market. So, as we have understood the importance of social determinants of health, now it's up to each one of us to take the insight gained today and turn them into actionable steps. Whether you are a healthcare professional, policymaker, or a member of a community, your contribution matters. Let's work together to create a future where everyone has equal opportunities for good health. Remember, addressing social determinants of health is not just an option, it's a necessity for building a healthier and more equitable world. Thank you all for joining us today for this insightful discussion on the social determinants of health market. Now we'll be proceeding with our Q&A session. So please feel free to ask any doubts or queries if you have. Over to you, Samudrika.
Thank you so much, Haritama, for this wonderful presentation. I'm very sure that all the attendees will put this to good use. So as Haritama has rightly said, the floor is now open for all your questions, and she would love to, answer them all. So if you have any questions about your current projects, industry trends, profession development, or anything else, so this is the perfect time to ask. So kindly put your questions in the chat box, and I'll take one by one. Let me just see. And in the meantime, let me just, since the questions are just coming up, let me just remind once again that at the beginning, I mentioned about, a few additional discounts that we'll be offering. So we'll be happy to disclose the additional discounts worth 1,500 US dollar for all the participants who chose to stay connected till the end of the webinar. So please be stay, connected, and post the Q&A session. I'll be disclosing about that. So let me just check. Okay. So I have a question here from Neetu. She's asking, what are some of the key challenges in the social determinant of health market? So she's asking about the key challenges of the market.
Okay, thank you, Niti, for the question. So, as I mentioned earlier, there are several challenges that pose threat to the market growth. One of the primary hurdles, I would say, is the complexity of addressing multiple determinants simultaneously. These factors are often interconnected, and finding comprehensive solutions require cross-sector collaboration and coordination. And lack of robust data infrastructure issues hinder the effective integration of SDOH data into the healthcare systems. Other challenges include data privacy concerns and the fragmented nature of data sources. However, as the market is evolving, the market players are making sure to address these concerns and gain maximum benefit from this concept, address various healthcare challenges related to improving patient health outcome.
Okay. Thank you so much for answering that question. I hope Neetu got the answer now. So let me take the next question here, and that is, how is the SDOH market evolving? So Jack is asking, how is the social determinant of health market is evolving?
Okay. So this market is, as I earlier mentioned earlier also, that this market is rapidly evolving, and the key factor contributing to this is recognition of the profound impact of non-medical factors on health outcomes. Health systems, governments, and stakeholders are increasingly integrating SDOH consideration into their strategies and decision-making process. There is a heightened focus on addressing health disparities and improving population health by targeting social, economic, and environmental determinants. Additionally, innovative partnerships are emerging between healthcare providers, community organizations, and public agencies to tackle these challenges collaboratively. Furthermore,
Mhm.
as data analytics capabilities grow, there is a greater understanding of social determinants of health patterns, leading to more targeted interventions and evidence-based policies. The market is also witnessing increased investment in technologies that enable better access to healthcare services, power individuals with information, and facilitate community engagement to create more equitable and healthier society.
Perfect. I think Jack has got his answer now. So I have time to take just one more question because we're running short of time right now. Okay, yeah. So I'll take this question. It is by Ashraf, and he's asking, how is technology playing a role in the SDOH market?
Okay. So technology plays a significant role in this market as it offers innovative solutions to bridge gaps and improve health outcomes. Talking about digital health tools and mobile applications, they have made it easier for individuals to access health information, connect with healthcare providers, and manage their health proactively. Also, the telehealth and telemedicine have extended health services to remote and unreserved areas, ensuring better healthcare access for vulnerable populations. Moreover, data analytics and artificial intelligence are being leveraged to identify high-risk communities and develop targeted interventions to address specific social determinants of health challenges. Additionally, geographic information system technology helps visualize and map social determinants, enabling stakeholders operating in the healthcare industry to identify areas which exhibit the greatest need. So social media and online platforms, they also provide avenues for community engagement and sharing of health resources. So technology driven initiatives are fostering greater awareness, collaboration, and efficiency in addressing the social determinants of health. So overall technology is expected to play a major role in driving this market growth.
Great, great. Thank you so much for that. So, Haritaba, thank you for addressing all the queries till now. And I'm sure it has cleared the doubts of all our attendees. So I would request all the attendees to, kindly post the queries to our email ID mentioned earlier by me, which is sales@globalmarketestimates.com. You can always contact us there to, request a sample copy of this report as well as any other report you are interested in, and we'll be in touch with you. So now it's time to, conclude our webinar, and of course to announce the, additional discounts that have been promised by me at the very beginning. So as we reach the final stage of this interesting webinar, we would want to take a minute to thank you all for your active involvement throughout this thought-provoking webinar. We hope the discussions were enjoyable and that you learned something important about the significance of social determinants of health. However, things don't finish here. So, as I promised earlier, we have an exciting announcement to make. We are delighted to give 10 hours of free analyst support to take care of your urgent research needs as a thank you for your commitment and participation. You can connect with us for any business related questions and we'll be pleased to help. The service is absolutely free, so do avail this offer. And additionally, we'll be sharing our executive summary of the global social determinants of health market as well. So, by identifying these markets ahead of time, you can strategically position yourself to capitalize on future opportunities. And if you wish to purchase the whole report before the end, before the day ends today, there will be a complete, flat 10% discount on the list price. And in addition to that, in addition to the 10 hours of analyst support that I mentioned earlier, We'll increase that to 100 hours, which again will be absolutely free for those participants who wish to purchase the report by the end of the day today. And as I mentioned earlier as well, please feel free to drop us an email on sales@globalmarketestimates.com with your immediate research requirements. And you can also, check our company website for the reports you are interested in, and we'll be happy to assist you accordingly. So together, let's pave the way towards a healthier, fairer, and more inclusive world for everyone. I would like to thank you, each one of you, for your time, and we look forward to your email. So let's stay connected, and thank you so much, everyone, for attending this webinar. So by this, let me conclude the webinar. Thank you so much. Thank you so much, Haritama, for your time.